Hey, good morning and welcome to the Patient Podcast. I'm your host, Vic Senese. Glad to have you on board. If you're watching us live, you can watch us on Facebook, LinkedIn, X, what am I forgetting? YouTube and Kick. All of those are coming to you live at the same time every Saturday morning at 10:30 a.m. Central Time. If this is your first time checking us out, be sure to go to our website at europatient.com, the best place to learn more about us. That's the best place to see more information and all of our past episodes. Boy, we got a bunch of them. So check out all of those past episodes for something you might have missed. Also, we've got these helpful information handouts that I put together. You can go there free of charge. Just copy them and take them with you to your doctor's appointment or just have them as a reference. They're yours. Go ahead and get those. Hey, we've got a great episode for you today. Be sure to always join us every week. And here we go. So today we're going to talk about bedwetting. What's normal, when it might be a concern, and what you can do about it. This talk is designed for patients and families who want to understand more about this sensitive topic. So bedwetting, or enuresis, the medical term, simply means peeing in your sleep when you didn't mean to. Very common in kids, but also happens to adults more often than you might think. So let's take a closer look. It's important to know you're not alone. Bedwetting is more common than people realize, especially in children. So around 20% of 5-year-olds still wet the bed at night. And about 10% of 7-year-olds continue to have occasional accidents. Perfectly normal. Most children will outgrow it naturally as they develop better bladder control and sleep patterns. But about 1 to 2% of teenagers and roughly 1% of adults still experience bedwetting. While it's often just a part of growing up for kids, in teens and adults, it may signal an underlying medical or emotional issue, making it important to talk to a healthcare provider if it persists. So bedwetting in children is usually a normal part of development and often happens because their bladder and nervous system are still maturing. Some children sleep so deeply that they don't wake up when their bladder is full, while others may have a smaller bladder that fills up quickly. Low levels of a special hormone called vasopressin, which helps the body make less urine at night, can also contribute. Stressful life changes such as starting school or a new sibling and a family history of bedwetting can also increase your chances too. In most cases, it's not the child's fault and not a serious medical condition. Most of the time, kids grow out of bedwetting. You should consider seeing a doctor about bedwetting if it starts suddenly, after a long period of being dry, especially if it happens more than one occasion, or 2 or 3 occasions. It's also important to seek medical advice if your child is complaining of pain, burning, or difficulty urinating, have daytime accidents in addition to the nighttime wetting, or show signs of emotional distress about the situation. Things like loud snoring, breathing problems during sleep, or unusually heavy urination may also indicate an underlying condition that needs attention. While bedwetting is common and often normal in young children, a doctor can help rule out medical issues and offer guidance if it persists or becomes a concern. Now for adults, bedwetting deserves a closer look. Though less common than in children, it often is a sign of an underlying medical or emotional issue. It can be linked to conditions such as diabetes, urinary tract infection, overactive bladder, sleep apnea, neurologic disorders, or the side effects of certain medications. Stress, anxiety, or past trauma can also contribute to nighttime wetting in some adults. Because it's rarely just a normal variant in adulthood, persistent bedwetting should be discussed with a healthcare provider to identify the cause and explore appropriate treatment options. Don't ignore it. See your provider to find out what's going on. There are several effective ways to manage bedwetting, depending on the cause and age of the person. Limiting fluids, especially caffeinated or sugary drinks, in the evening and making sure to use the bathroom right before bed can help reduce accidents. Who would have thunk? Bedwetting alarms, which wake the sleeper at the first sign of wetness, are also effective for children. I'm going to talk a little more about that. Protecting the mattress with these absorbent pads and things that you can use to put on the cover or just under the sheets can also reduce stress and make cleanup easier. Establishing a consistent bedtime routine or encouraging regular bathroom habits during the day also help train the bladder. For adults or persistent cases, a healthcare provider may recommend medications, behavioral therapy, or treatment for an underlying medical condition contributing to the problem. Now we're going to talk about those bedwetting alarms. Bedwetting alarms are one of the most effective treatments for children and sometimes teens who struggle with nighttime wetting. These small devices work by detecting moisture as soon as a few drops of urine are released and then sounding an alarm or vibrating to wake the sleeper. Over time, this helps train the brain to recognize the feeling of a full bladder and wake before wetting happens. Bedwetting alarms are safe, drug-free, and often more successful than medications in achieving long-term dryness. Now keep this in mind. It can take several weeks or even a few months for full results. So patience and consistency are key. Many families find alarms helpful because they teach children to connect their body signals with waking up to use the bathroom. So where do you get these things? Well, alarms can be purchased where everything else can be purchased, Amazon, right? So these are a couple examples of different ones. So over here on this side is the pretty inexpensive one, like around $35-40. I kind of like it because it's got that little sensor right in the underwear that picks up even the earliest little drop. And then the one over here, which is like more of a pad, this is more expensive. But it's also works really well. I could tell you that I work with a pediatric urologist, and often this was our go-to for bedwetting for children. Get a good alarm system, and they really respond well to it. But it's got to be one that detects just a very, very early little bit of leakage of urine to wake them up. Now, here's something we don't always think about: social impact. If you're the parent and you've got a child who's wetting the bed, you're all upset because you got a, mess to clean up or maybe a bed that got ruined or something. But these poor kids have a lot of social and emotional impact from bedwetting. For children, it may lead to feelings of embarrassment, shame, or low self-esteem, especially if they're teased by their peers or feel different than others. This can affect their social interactions, friendships, and willingness to participate in normal kid activities like sleepovers, camping, that type of thing. Now, adults who experience bedwetting also face embarrassment and anxiety, which can lead to social withdrawal, decreased intimacy with partners, and even depression. I had a case early on in my career. I was taking a history of a patient coming in. It was a young couple, and the wife and the husband came in, and they just got married, and she came in and says, "Listen, you guys got to fix this guy. There's something wrong with him. He wets the bed every night." Well, she was right. There's something wrong. But he did have a history of bedwetting his whole life and never managed to tell her, probably out of embarrassment. So it is something you need to come in and don't be afraid to talk to someone about. Now, the stigma surrounding bedwetting often makes people reluctant, though, to talk or seek help, which can worsen feelings of isolations. Understanding and support from families, friends, and healthcare providers plays a crucial role in reducing these negative effects and encouraging individuals to find the help that they need. Now, we're talking about medication as treatment options. They can also be a great option for stopping bedwetting where behavioral changes and alarms don't work. The most common one, and this was one that's been out, was kind of out after I was already in practice, so it was kind of nice when it came into effect, is a drug called desmopressin, or most of the time it's abbreviated DDAVP, and I'll talk more about it on how it works. But this drug is ideal. It comes in a spray form or a tablet, and great for kids going on sleepovers. They take this, and it helps to cut down the amount of urine that they make, and probably will prevent them from having an accident. So it kind of gives them some control in their life again. Now, for adults, there's other medications that we also use, things called anticholinergics, which help calm down the bladder, and things like tricyclic antidepressants, such as imipramine, that we use that have these great effects on helping to cut down some of these problems. They have more side effects, and generally we don't like to have people on these things long term for those reasons. But always talk to a doctor about the risk and benefits of starting any medication for bedwetting. Now, this DDAVP, or desmopressin, as I talked about, how does it work? So your kidneys, they're kind of like we see over here on this guy, turning the water faucet on. It's kind of like a water faucet. It produces urine constantly, but it controls how much you need to get rid of. So it controls the volume or the flow of the urine, sort of as the faucet that kid's playing with controls how much water's leaving that faucet. Now, when the faucet's wide open, a lot of water comes out. You're going to make a lot of urine, and your bladder's going to fill up quickly. Now, the only way you can turn that faucet off is chemically with a drug like DDAVP. And that's what it does. It basically turns the faucet off. So the kidneys, at the level of the kidneys, they stop producing so much urine. And that's the key. So if you cut down the amount of urine, they're not going to have a full bladder that's going to make you want to have to go to the bathroom, and you'll get through the night. So it's really a neat drug in that it works well, but it should only be used in particular cases, not something you keep somebody on all the time. Let's think about it. You're supposed to make urine, so you don't want to be stopping that effect. Well, thank you for taking time to learn about bedwetting today. Remember, whether it's a child or an adult experiencing it, bedwetting is a common issue, nothing to be ashamed of. With patience, the right support, and proper treatment, most people can manage or overcome it. If bedwetting is affecting your life or the life of someone you love, don't hesitate to reach out to a healthcare provider for help. You're not alone, and solutions are available. So take care and stay hopeful. Well, I hope you enjoyed that episode. Let's see you all next week at the Europatient Podcast.